Well, a very good evening to you and welcome to RTV News with me, Fiona Mbabazi. Now, the National Child Development Agency in Rwanda is calling upon parents to pay keen attention to the nutrition of their children so as to avoid malnutrition and stunted growth that poses risks of diseases and even death. Gloria Mutesi kicks off tonight's edition with that story.
A cross-section of mothers say they are able to get a balanced diet for their children, while others say that due to the COVID-19 pandemic, they are unable to provide a balanced diet for their children. I give my baby a wide range of fruits, including passion fruits, oranges, bananas, and I also give them vegetables, fish, and a wide range of foods, while I also continue breastfeeding them. And that is why when I go to see the doctors, the report is that my child is growing well. I have twins. Before I used to buy them fruits, but it's been hard lately. A week can go by and they haven't eaten any fruits because I don't have money to buy them fruits. I can't even get meat for them. It's already hard enough to get potatoes or cassava to feed them. In the latest report, the United Nations Children's Fund says that globally malnutrition has remained the norm for the past 10 years. The National Childhood Development Agency says that while caring for a child's nutrition, the number of times a child is fed and the diversity of foods he or she is fed are taken into account.
These meals should comprise of a variety of foods. The child should get 4 types of food out of the 7 required, but parents haven't fully adapted to that. The second reason is that some parents who are in the first of the classification can't afford to provide the balanced diet, and the fact that parents sometimes don't have the time to prepare these meals for the children as they should. And most of what is missing from the diet are proteins, which are more important for every child.
According to NCDA, in 2010, children who were fed a balanced diet at a required time stood at 17%. In 2015, the number rose to 18%, while in 2020, the number rose to 22%. Faustine Mashara says not having a balanced diet causes malnutrition, which has a profound effect on children.
When a child is not properly fed, they also lose appetite and become stunted in terms of growth and height, and this has adverse effects of the development of the child's brain. When they grow up, their intelligence levels are low and they are unable to perform certain tasks. Studies have shown that a child who suffers from malnutrition easily falls sick and are at the risk of death. Through our vision of 2050, we believe Rwanda will have a knowledge-based economy, and that is why we care about children. Protect them from stunted growth so they will grow up to contribute to the economy.
The Demographic and Health Survey 2019-2020 found that stunting in children was at 33%, down from 38% in 2016. The goal is to reduce stunting in children to under 20% by 2024.
Now, the Ministry of Local Government is calling on all Rwandans to continue observing the COVID-19 measures that have been put in place, despite there being more than 2 million Rwandans who have received the COVID-19 vaccine, including 1.5 million of whom are fully vaccinated. From this number, Gabi Muvunyi with more.
It is evident that some people across the country have become complacent when it comes to adhering to the COVID-19 measures, with some people seen not appropriately wearing their face masks, while on the other hand, people wear them only when they see the police or the media. Some of the youth volunteers speak out on the challenges they face on the field. People do not wear their masks properly, especially the taxi motorcyclists. They blatantly tell you no and may argue with you. Also, those people on the roadside, they give us quite a hard time. When you tell them to put on their masks, they also tell you no. The executive secretary of Nyakabungo Cell in Jari sector in Gasabo district say they do continue to work on campaigns to encourage the members of the public to adhere to the COVID-19 guidelines regardless of their vaccination status.
Igihugu cyacu rero kiraje inshinga no kurandura iki cyorezo
As a country, it is our goal to fight the COVID-19 pandemic, and we are happy of where we stand in the fight. Members of the public have been collaborating by observing all the necessary guidelines.
A psychologist and assistant lecturer at the National University of Rwanda says that in such cases when the pandemic seems to be declining, some people are complacent while others choose to still adhere to the preventive measures.
Akenshi rero nk'ikintu cyari giteye abantu ubwoba cyangwa se kibahangayitse hakaba yuko imibare itangiye kugenda igabanuka.
As the numbers decline, people tend to be less scared of the pandemic and lean towards being complacent, and they carry themselves like COVID-19 is no longer there. While on the other hand, there are those who continue to follow all the preventive measures because they know that if they don't, the numbers are likely to rise again and may go back into lockdown. Therefore, everyone needs to work together in observing the preventive measures so we may fight this pandemic.
Gushishikarizwa kwirinda kugira ngo turusheho guhashya icyorezo cya COVID.
The Minister of Local Government, Gatabazi Jean-Marie Vianney, emphasizes that despite the large number of people being vaccinated, it doesn't mean that people should stop observing the COVID-19 preventive guidelines.
Koroshya ingamba ntabwo bivuga ko icyorezo kidahari. Kandi gusubira inyuma abantu bakirara.
Easing the COVID-19 preventive guidelines does not mean the pandemic is done. But if people continue to neglect the measures, the preventive guidelines will be tightened again. I want people to take note of that. We urge the local authorities to put more efforts in their campaigns because members of the public are aware of what they need to do. They know the disadvantage of being put under lockdown. People need to understand that the pandemic is not over, even for those who are vaccinated. Anything can happen. Another variant can arise and affect us all. Also put into consideration that not everyone has been vaccinated.
Turifuza ko abantu bumva ko icyorezo kitashize n'abikingirije bakumva ko bitarangiye.
According to the Ministry of Health, in Kigali City, the infection rate is down to 0.4% from 5% in July. Through random testing of a sample size of 5,000, only 20 people were found infected with the virus, of which 10 were from another province. Rwanda now aims to vaccinate at least 30% of the target population by the end of this year. Currently, 21% of the 7.8 million are fully vaccinated, meaning 12.6% of the entire population. Gabi Muvunyi, reporting for RTV News.
Thank you, Gabby, for that. Now, a cross-section of doctors working in over 315 private hospitals in the country are confident that they will continue to invest in the medical sector by bringing in state-of-the-art equipment as well as qualified staff to provide better services to their clients, even though they still have a challenge of an outdated law governing them, as well as prices that have not been revised in the last 5 years.
Some residents that seek treatment services in private hospitals say that although they have a number of reasons for choosing private hospitals, there are still some areas that can be revised. They have good services, the hygiene is generally good and the customer care is great, which is why I'm influenced to go to a private hospital instead.
Usually they take a lot of unnecessary tests so they could earn more perhaps. That should change. They should only take the necessary one. I have experienced this where I went to a hospital and they took many tests.
In an effort to improve service delivery, doctors in private facilities say they are committed to investing in the medical sector. Officials from the legacy clinics say they are expanding the hospital and have purchased specialized testing machines, including an MRI scanner. Dr. Ntwari Ndizeye says it will help many people in the country who usually have to wait for long at various hospitals and delay treatment.
The MRI scan gets images for every part of the body, whether to check the progress of tumors, the tumor marks. All this is now possible with this MRI machine. It will help the surgeon before they go ahead to perform any surgeries.
Dr. Muyombano Antoine, the chairman of the Rwanda Private Medical Facilities Associations, explains that they do not tolerate mistakes made because a mistake can lead to a loss of life.
Iyo ikosa ribaye tugomba kurimenya.
If a mistake happens, we investigate and even inform the Ministry of Health, and if need be, punishments are given. As an association, we don't have the rights to give punishments. Our responsibility is to ensure that these mistakes don't stem from inadequate training, lack of resources, or negligence.
On the issue of the 1998 law governing private clinics that is outdated and the prices that have not been revised for over 5 years, Dr. Cornel Nihabose, the head of clinical and public health services at the Ministry of Health, says that the issue is currently being discussed between the ministry and the association.
The ministry have drafted that amendment and has consulted the Law Reform Commission. The Law Reform Commission has provided some guidance and provided some inputs. So at this stage we are remaining with the guidance from the higher authorities, later to be submitted to the Parliament for final amendments. We know that it is dated 5 years ago, and we must revise those tariffs. The consultation we started to know what is the rationale, how can we do it. So we agree that it can be revised, and we start some consultations. Maybe in future we can have the new tariff.
The number of people going to hospitals increased by 30% from 2015 to 2020, and to date Rwanda has 2,040 hospitals, 1,725 of them being government hospitals and 315 private hospitals.
And now from health matters to parliamentary matters, members of the Public Accounts Committee in the Chamber of Parliament have expressed concern that the Ministry of Finance and Economic Planning have misused government funds to an equivalent of 3 billion Rwandan francs from the delay in implementing some of the projects. Sam Kalisa with it.
The Public Accounts Committee has revealed that there were delays in some of the projects whose implementation cost was from loans, and that this led to the government paying fines, with up to 3 billion Rwanda francs fines having so far been charged from the government. An example is the 120 million project that was supposed to promote export-oriented agriculture, that was also supposed to start in 2013 and end in 2017, and has not yet been completed, according to the chairman of the Public Accounts Committee. It's an 120 million project that started in 2013 and has not yet been complete, yet it was supposed to be completed in 2017. We had discussions with Minecofin about the project, but we also had discussions which was with RBA, which was in charge of its implementation. They showed us that there is progress, but these penalties that have been paid by the government due to the delay wouldn't have been there if the project was implemented well. There are losses that the state incurs, and some members of the Public Accounts Committee say they do not fully understand where the problem is. When we're in Parliament, they bring projects and they come and tell us to vote in favor of them because they say that these projects will benefit the country. So they say these projects are urgent. You later find out that what seemed to be urgent took a long period of time to be implemented. Tell us exactly, when signing up for the money, did you conduct the survey? Was there a plan? Because honestly, what causes the delay, yet the money is there, to the extent it puts the state into fines? The Director of Finance at the Ministry of Finance and Economic Planning admits that some mistakes have been made but are about to be corrected.
President, your commitment twabaha.
Chairman, I can give you the assurance that the mistakes and mismanagement that were shown here will be corrected.
The orientation twagiye tugaragazwa tutazabisubira. Murakoze.
The Public Accounts Committee also received the National Institute of Statistics of Rwanda, the Rwanda Public Procurement Authority on issues related to technology used in giving tenders. The National Institute of Statistics of Rwanda was asked why the report of the Auditor General that shows that the agency has implemented the recommendations of the Auditor General at a rate of 50% and why there's an employee that the agency has paid tuition for worth $66,000 and ended up not serving the institution. The Director General of the National Institute of Statistics testified that the employee was taken to court and has agreed to pay the amount back.
Now, the Ministry of Environment says Rwanda is continuing its environmental programs with a focus on reducing greenhouse gas emissions and the use of gas to protect against deforestation.
The central areas in the Central African region, including Rwanda, account for 15% of the total land area and 5% of the land's water resources. The goal of the COMIFAC is that land accounts for 17% of the total land area and water for 10%. The Deputy Executive Secretary of the Forum finds that some of the reasons why this goal has not been achieved yet is due to the fact that the laws of the member states have not been harmonized, thus affecting the difficult cross-border issues such as parks and so on.
Il faut que les pays renforcent la coopération sous-régionale pour la lutte contre le braconnage. Vous savez, j'ai l'habitude de dire.
It is important that we cooperate more in order to fight poaching. I love to say that animals do not need passports nor visas to cross over to other countries. That means one country cannot fight poachers because they have laws in place for this, while the neighboring country has none. That's why we have to work together and protect the environment. And that's why COMIFAC, which Rwanda is part of, is important.
Et je pense que c'est ce que tous les pays de l'espace COMIFAC, y compris le Rwanda, sont en train de faire.
Currently, 206 strongholds are among the 10 member states of the COMIFAC, which are dominated by flora and fauna. Environmentalists believe that countries should have a lasting partnership and anonymity in raising funds to help in the field of environmental protection in general, and that this level be implemented urgently by countries that are preparing for their policies.
Ntabwo tuzageza ku myaka 2 tutaratangira kwikorera gaze icanwa mu Rwanda.
It will not be until 2 years before we start using our own gas here in Rwanda. We have a private sector project in Kivu to convert methane into combustible gas. There are many other things that we need to do, and those who have a car that emits smoke should go and take it for service. The very old ones will get out of the way, and we will also reduce the emissions from our homes and the waste from our homes.
For the workshop has brought together technicians from 10 Central African countries, where each country will present a report on its progress and prospects for impact. Innocent Mogabo, RTV News.